Like Dr. Rosen, I too will be working in the emergency department during Thanksgiving weekend. My husband and I have made the very difficult decision to stay home and not visit family on Thanksgiving Day. Instead, what we've chosen to do is order takeout from one of our favorite restaurants here in Nashville that we want to support during the pandemic. This is a tough year for everyone, and we will miss being together this holiday with our parents, siblings, nieces, and nephews. But I'm exposed to this virus at work nearly every day, thankfully with adequate PPE. But despite that, I'm still terrified of infecting one of my loved ones. So this year, we will see our families from the safety of our computer at home. I wish everyone would think long and hard about their Thanksgiving plans and how they might be contributing to the spread of COVID by traveling or getting together in groups. COVID is everywhere. It's in every county of our state and every state in our country. Almost every day, we break another record for total patients hospitalized for COVID here in Tennessee. The healthcare system here in Tennessee is already under enormous strain, and I'm not the only one concerned about what things will look like in our hospitals 2 weeks after Thanksgiving if it's already this bad now. My hospital, and pretty much every hospital in Nashville, is either full or very close, and that impacts how we operate in the emergency department. If hospital beds are filled to capacity, we have nowhere to move patients who need hospital admission. That means we hold those patients in the emergency department and have less rooms free to care for walk-ins and other emergencies such as heart attacks, strokes, or traumas. Lately, we've seen our waiting rooms fill up with patients waiting hours to be seen in a treatment room, many of them likely infected with COVID, which unfortunately places all of the patients in our waiting rooms at risk. We are worried about what the delays in care will mean for our patients. And I am personally terrified that my hospital being full could result in someone dying in the waiting room. This pandemic has taken a toll on me and my colleagues, not just physically, but emotionally. It's as if we live in two separate worlds. There's the world inside the hospital where we see patients coming in, gasping for breath, their lungs full of infection. And then there's the world we see outside the hospital, with people not wearing masks, eating out in restaurants, partying on Lower Broadway, and planning big Thanksgiving gatherings as if everything is normal. It's very frustrating to see people not taking this virus seriously. One of the simplest things people can do to help us healthcare workers is to wear a mask. The recent studies from Vanderbilt have shown that masks and mask mandates work. The study showed counties without mask requirements have higher hospitalization rates and twice the death rates from COVID. Governor Lee does not seem to understand what we as frontline physicians are dealing with every day. And so I would like to extend an invitation to you, Governor Lee, to visit my emergency department or any of the emergency departments in Tennessee, where hospitals are quickly reaching or already are at capacity. Come and see what full COVID floors and ICUs do to the emergency departments, filling up our treatment rooms, overflowing the waiting rooms, and forcing us to divert ambulances elsewhere. You need to spend time talking with physicians and nurses about the stress we experience when we have to treat an emergency in the hallway or the waiting room because all of our treatment rooms are full. Governor Lee, you aren't responsible for COVID, but you are responsible for leading us through this crisis. As a frontline physician, I implore you to listen to the health experts and make the tough decisions. I understand that making masks mandatory is a tough and likely unpopular decision, but it's the right decision and one that will save lives. You will see this if you visit the hospitals and see firsthand how your current strategy is not working. We desperately need your help. I join my colleagues today pleading with you to help us do our job and protect your constituents by issuing a statewide mask mandate. Physicians and health experts have been saying for months that this is what is needed in Tennessee. It's time to listen to us and to them. We can defeat COVID, but it depends on us having a statewide coordinated plan and strategy and decisive leadership from you, our governor.